Our patient today is Jenny Block, and she is a 36-year-old Caucasian female, mildly obese, and 5 foot 6 inches. She's 190 pounds with a history of type 2 diabetes, and this is her 3rd pregnancy. She is currently 24 weeks and 3 days gestation with twins. She works full-time as a receptionist and comes from a working-class family. Nobody in the family went to college, and the highest degree she has is a high school diploma. Resides with her husband and 2 elementary school-age children. They currently rent a small home within city limits. Her blood pressure was 118/86 at her first prenatal visit, 119/87 at her second prenatal visit, and 141/90 at her 3rd prenatal visit. Her blood pressure today at her 4th prenatal visit was 146/92. The patient's risk factors include family history of hypertension, multiple fetuses, and older than 35. As well as obesity and medical history of diabetes. By the end of the teaching, patient will verbalize 4 signs and symptoms of pre-eclampsia, verbalize a meal that is low in sodium, verbalize 3 complications that can arise from untreated pre-eclampsia, and demonstrate how to use electronic blood pressure machines as well as urine dipsticks for proteinuria. Hi, Mrs. Block. My name is Marissa. I'll be your nurse today. We're going to go over a few things regarding your new diagnosis of pre-eclampsia. But first, we're going to take a history.
Okay.
Okay, so how are you feeling today?
Pretty good. I just have a pretty good headache right now.
Okay. All right. Have you ever used any illicit drugs?
No, ma'am.
Okay. Have you ever used any products containing nicotine?
I used to smoke, but I don't anymore.
Okay. And how many packs per day?
About 2.
And when did you quit?
2 years ago.
And do you drink alcohol?
No, ma'am.
How would you describe your diet?
Considering I have 2 kids at home, I have a pretty busy schedule, so we usually eat out most of the time. I've been trying to change that, though.
How about your salt intake? Do you use a lot of salt while cooking or in the meals that you eat?
I would say so.
What is your activity level?
Well, I go to an aerobics class, but I've only been going about once a month, and I like to walk.
Okay. How often?
I only walk like once a week, maybe.
Okay. Would you say that these walks are mild, moderate, or intense?
Definitely mild.
Okay. Do you have anything else you enjoy doing for physical activity?
Just chasing and running around with my kids.
And how's your stress level at home and work?
Pretty high.
Okay. Do you do anything to decrease that stress?
I like to sit in my bathtub.
Okay, so today we're going to be using this packet full of information and this PowerPoint right behind us to talk about the signs and symptoms of pre-eclampsia, diets, complications that can arise when pre-eclampsia is untreated, and I'm going to show you how to use the electronic blood pressure machine and the urine dipsticks. So we just wanted to go over some information on what pre-eclampsia is. So a normal blood pressure is generally below 140/90, and in pre-eclampsia it elevates, so it's over 140/90. And you also have proteinuria, which is protein in your urine. Now this can be measured by urinating in a specimen cup and dipping a protein urine indicator into it, and it shows up the color just like you would for the pH for a pool.
Okay.
So there's information on the slide and in your pamphlet on blood pressure if you'd like some more information on what it actually is. Pre-eclampsia usually occurs in women after 20 weeks of pregnancy, so you're 24, so right about that time. And the cause is unknown, but there's evidence that suggests that the placenta is the key factor because the only way to cure pre-eclampsia is delivery.
Okay.
But this is a diagnosis that can be managed with lifestyle changes and daily monitoring.
Well, that's good.
So, as we already went over, the early symptoms of pre-eclampsia is the blood pressure over 140/90 and the proteinuria, which is going to be +1. So, some other symptoms that are more severe and warrant a call to your doctor are blood pressure above 160/110, proteinuria +3, sudden headache, sudden weight gain. We say about 3 pounds in 24 hours or 4 pounds in 3 days is a cause for concern. Swelling of your hands, legs, feet, and especially your face. Nausea and vomiting, epigastric pain, vision problems, blurred vision, double vision, stars, numbness in your face, arms, legs, feet, decreased urination, dizziness, slurred speech, and convulsions or seizures. Lifestyle changes that should be made to properly manage your preeclampsia are maintaining a healthy weight, avoiding a high sodium diet, increasing your water intake, and avoiding stress. So a BMI of less than 25 is ideal, and this can be achieved through a realistic diet and exercise plan that we can make together.
Okay.
Now, I know you said that you like walking in your aerobic classes. Maybe make a plan to go to your aerobics class 2 times a week and walk the dog, or go for a walk with your family 3 times a week for about 30 minutes.
Okay. Yeah, I can do that.
Okay? And you want to drink enough fluid throughout the day to keep your urine a pale yellow so that you know that you're hydrated. This will probably be around 64 ounces per day, or about 8 glasses. Now, if you have a hard time keeping track of how much water you're drinking, there are water bottles that are 32 ounces, and as long as you drink 2 of those per day, you'll know how much you're taking in.
Okay.
And I know it's hard to avoid stress, but you want to as much as possible, and if you're feeling upset, try taking a walk and doing breathing exercises. There's plenty of videos on YouTube and apps that you can download on your phone that will help you breathe and relax. And if your employer will allow it, take breaks when you're feeling tired and overwhelmed.
Okay, thank you.
And of course, we want you to get plenty of sleep, 8 hours at least per night.
I try.
So now we're going to talk about some complications of preeclampsia. We stress the importance of lifestyle change and management to reduce the risks associated. So these risks include preterm delivery, seizures, fetal death, and maternal death. If not managed, preeclampsia can develop into eclampsia, which are seizures in a pregnant woman that has no other reason for a seizure. Most often these occur in the last 10 weeks of pregnancy, during labor, and the first 48 hours of postpartum. Another reason we make sure your diagnosis is properly treated is because preeclampsia reduces the blood flow and oxygen through the placenta and to your baby. Okay, so this is your uterus and this is your placenta, so you know the blood and the oxygen goes through the placenta, through the umbilical cord to your baby.
Yeah, I've read books about the placenta, but I didn't know what it actually looked like, so thank you for showing me that.
So like I said, this reduces blood flow and oxygen through the placenta and to your baby. This decrease in blood flow and oxygen causes intrauterine growth restriction, which is an inability for the baby to properly grow.
Yep.
So these are 2 placentas, and they are both at 35 weeks gestation. This is our healthy placenta. As you can see, it's bright red and full. The baby is noticeably larger, his cord thicker, and he's measuring correctly. So this is our placenta with preeclampsia. The decrease in blood flow and oxygen causes intrauterine growth restriction, which is the inability for the baby to grow properly. So this placenta is gray, weak, small. The baby is physically smaller, as you can tell. The cord is weaker, and it's only measuring at 30 weeks.
I didn't know because my blood pressure was so high, it could decrease the perfusion to my baby and make him so much smaller.
Yep.
So in order to make sure your baby is properly growing and your preeclampsia is managed, your prenatal care and follow-up appointments are extremely important. Appointments for fetal non-stress tests will be twice a week, and these should not be missed unless there's an emergency. Lab work and ultrasounds for measurements of the amniotic fluid and assessment of fetal growth will also be done once a week.
Okay.
So here's a printout of all of your appointments for the month, so you can put it right on your refrigerator so that you always know when you'll be coming in.
Yes, that would be very helpful.
So now I'm going to show you how to take your blood pressure at home. Since you have to do it daily, it's very important that you know how to properly do it.
Okay.
So you'll stick your arm through here, and come up, and tighten it like that.
Okay.
And then we turn the machine on, and we hit start. And that is all you have to do.
Okay.
And you're going to want to make sure you write down your daily blood pressure. So in here, we've provided some blood pressure trackers. So you have the date, the time, the blood pressure, as well as your weight.
Okay.
So that is also very important. Do you have a scale at home?
I do.
Okay. So you know you'd want to do it at the same time every day in the same amount of clothing.
Yeah, I usually weigh whenever I first get up in the morning.
Perfect. So now I'm going to show you how to test your urine for protein with the testing strips. So you're going to get a urine specimen cup, and you're going to urinate in it, and it's okay if this is all you can get out.
Okay.
It's all you need. So you'll have your legend that will show you the colors and the protein urea. So it'll be +1, +2, +3.
Okay.
And you're going to take the dipstick, and you're just going to dip it right in and out, and then it'll go ahead and show you what color it is, and you can just hold it right up to it. It'll be a perfect match.
Okay.
So now that we're all done with the information, I wanted to know if you had any questions.
Not that I can think of right now.
Okay, good. So signs and symptoms of preeclampsia. Can you tell me at least 4 for when you would call the doctor?
Yeah, I can do that. So blood pressure of 160/90, a severe headache, epigastric pain, and the vision changes, like you said, like the double vision and like a fuzzy seeing.
Perfect. And you would want to call your doctor right away. Do not wait until it gets worse. Okay. So now we'll talk about diet. So we said low sodium is the best for preeclampsia. Can you tell me what kind of meal you would have for a low sodium diet?
Well, I really like bacon wrapped shrimp with some canned beans and broccoli.
So bacon is a processed meat which has a lot of salt. And canned beans or vegetables, anything that comes in a can, generally has a lot of sodium as well.
Okay, I didn't know that.
Yes, so fresh vegetables or even frozen are great options. And then as for the protein, lean meats such as chicken or low mercury fish such as salmon are our best options.
And the shrimp was okay, right? Okay.
And instead of salt, you can use herbs and spices to flavor your meals. And as for the beans, you could use dry beans.
Okay, so I could just do the shrimp with a little bit of herbs and spices, and then I can do beans, but I can make them out of fresh beans, and then the broccoli.
Okay. And so complications that arise from preeclampsia, do you remember what those are?
Yes, preterm delivery, seizures, and maternal death.
Okay. And now before you go, I'd just like you to show me how to use the blood pressure cuff and the urine dipsticks.
Okay. Yeah. So I will take this. Is it on? And then I'll lay my hand down and then press.
Okay, perfect. So just remember, if you see any weird numbers, too high, too low, you think it might not be right, you could always just recheck it again. Just
Okay,
like a
okay.
urine.
So I will urinate in this cup, and then I'll take one of these strips, and then dip just the tip in, and then I'll wait, and then I can compare it to the legend, and it looks like I still have about +1.
Perfect.
Thank you.
Okay, so now that you've verbalized 4 signs and symptoms of preeclampsia, a meal low in sodium, 3 complications that can arise from preeclampsia, and how to use the electronic blood pressure machine and the urine dipsticks, we are all finished.
Okay.
So remember that you have this pamphlet to take home with you. All of the information that we went over today, all the information in a PowerPoint is going to be all in that packet, as well as other resources from the community and from us. So just give us a call if you have any other questions.
Thank you so much.
Of course, have a great day.
Thank you, you too.